Hello everyone and welcome back. I'm Gwendolyn Halle, a medical microbiologist, popularly known as the medical professional with the difference, and I bring you knowledge on health, on medicals, hygiene, business, farming, and a lot more. Stay tuned. So the main theme is why you should stop taking paracetamol, aspirin, ibuprofen for period pain, and I'm going to tell you why. Paracetamol, ibuprofen, and aspirins are all non-steroidal anti-inflammatory drugs. They are all NSAIDs, just as mefenamic acid is also a non-steroidal anti-inflammatory drug. Now, I've taken all the drugs I have mentioned. The reason why I'm focusing on paracetamol, ibuprofen, and aspirin is because it's widely taken around the world for period pain. It's a common drug, an over-counter drug where everyone can purchase. At least everybody has that in their handbag or in their drug store at home or in their drug cupboard at home. So it's a drug that these are drugs that ladies mostly have. So I would like you to reconsider and switch to mefenamic acid, and this is why. While I was taking ibuprofen, paracetamol, or aspirin, I noticed that I had to take either 2 or more or 3 more tablets, morning, afternoon, evening, and I would still experience heavy bleeding, and I also experienced the period pain that I was having, or that I was targeting, I was trying to reduce, that at that time actually went away or subsided after at least 3 tablets. So in the long run, there are side effects of taking all these non-steroidal drugs, and you may develop gastric ulcers, gastritis, holes in your stomach or in your intestines, bleeding in your stomach or your intestines, and the risk is even higher if you're taking alcohol while taking these drugs. And knowing that as a lady you're going to be having your period every month, know that you're going to be, and also that you're going to be taking these non-steroidal anti-inflammatory drugs is something to really think about, because you are really exposing yourself to another health condition which will demand you to spend money and will actually affect your health badly, especially when you're trying to eat, or when you're trying to eat food, you're going to be having a lot of stomach upset and pain, and you're going to be burning a lot of gas. So it's something to reconsider, because these non-steroidal anti-inflammatory drugs taken long term every month, and you're taking at least 2,000 milligrams of it, because you have to take 500 milligrams, 1,000, like at least 2 tablets a day. Some people take 3 tablets in a day. So it's something to really consider. But on the other hand, mefenamic acid is still under the non-steroidal anti-inflammatory drugs, but it works differently. And I noticed that while I was taking mefenamic acid, I only had to take 1 tablet, 500 milligram, and it really worked. And how does it work? It works by reducing the prostaglandin, the hormone, the prostaglandins that are responsible for heavy periods and period pain. So it actually works by thinning the lining of the uterus or of the womb and reducing the period pain. So it will reduce the inflammation, it will reduce the pain, and you'll be okay. So you may just need to take 1 tablet or 2, but normally I just take 1 tablet, and I normally take a tablet when I know that is around when my period is coming, just 1 tablet, and I realize that when my period starts, then it's okay. But I'm telling you, that's how it used to work. I think mefenamic acid is more effective for period pain than ibuprofen, paracetamol, and aspirin. Now, this drug can be prescribed by your doctor, by your GP, by your gynae, and it can also be prescribed at the pharmacies by a certified pharmacist. And mefenamic acid is the active ingredient that is sold under different brand names. So that is one effective way of reducing the risk of having gastric ulcers or peptic ulcers or holes in your intestine while taking non-steroidal anti-inflammatory drugs, which we're required to take every day. Mefenamic acid is really good, so I really think you should give it a try. Another thing people do, or some doctors advise, is that ladies could get hormonal coils which are injected into their bodies. And for me, if you're a lady and you have not yet started having kids, I would suggest that you halt on that for a bit and have your kids, and then you can take it, because hormonal implants or coil, they all come with their own side effects, and it varies from woman to woman, you know, and you may have problems conceiving because it may alter your menstrual cycle. So please do try mefenamic acid. It's really good. Mefenamic acid is an active ingredient. It's not a brand name, so you can Google about it, you can research about it, and it's really good. As a lady, mefenamic acid is the bomb. I took mefenamic acid for a few years. I took mefenamic acid for a few months and I stopped. But on a serious note, if you have tried paracetamol, ibuprofen, aspirin, and you're still not getting the results, your pain is not reducing, and you switch to mefenamic acid and it still can help you, maybe you should check if it's not a spiritual problem. Maybe you should check to try and sort it spiritually, because if you try to take hormonal pills for your period pain, you may just find it very difficult having kids or conceiving in the near future. I know of a celebrity. I think she gave her testimonial when she was younger. She was having heavy and painful periods, and she went to the doctor. Now, this is not in Africa. I mean, she's out in the US, and she was given a hormonal implant, I think pills, a hormonal implant that she should take. So she took it for a very long time, until when she was about 40 plus, when she got married and wanted to have kids. She said it was so difficult for her to have kids. She started having a lot of miscarriages. So please, before you go taking hormonal drugs for period pain, really think about it. Really think about it. So she had her daughter through a surrogate instead of, she could not conceive. So that's something to really think about, ladies, when you want to go into hormonal implants or hormonal coils for period pain. Yes, they work. They actually reduce the bleeding. They actually reduce the pain. As she was testifying, yes, the pain was reduced. Yes, the heavy bleeding was reduced. But she didn't know that it didn't change. When she stopped it and she wanted to have kids, it was a whole new episode. It was like her body just went haywire on her. So do think about it, and if you have any comments, any questions, do pop them down below and we'll answer them for you. And if you're just joining this channel, please like, share, and if you are a returning subscriber, I'd love to say thank you. Thank you for watching. Thank you for liking and sharing. Thank you for giving this channel and the videos visibility across the globe. Bye-bye.